Hello, my name is Sarah Jane Rogers and I am working with the Clinical Genetics Department at the Leicester Royal Infirmary. This is a podcast about how taking a small dose of aspirin every day may be used to reduce the risk of tumours in adults. Aspirin, even in small doses, can occasionally have very serious side effects and is not recommended for those with blood clotting abnormalities, asthma, allergic reactions to aspirin or stomach problems. It is strongly recommended that anybody who is considering taking aspirin regularly to reduce their risk of cancer discusses the issues raised in this podcast with their general practitioner, and please note that using aspirin in this way is not recommended for the general population without a family history of cancer or pregnant or breastfeeding women at the time of this recording. Aspirin is a non-steroidal anti-inflammatory drug which is usually used as a painkiller. However, it has been found to have a number of other effects on the body which may be beneficial or harmful to health. A daily low dose of aspirin has been used for many years to reduce the risk of heart attacks and strokes. It does this by thinning the blood and reducing the risk of clotting. Whilst following up large numbers of patients prescribed aspirin every day, researchers noticed that it was rarer for these patients to develop tumours than they were expecting. This effect was not seen if the drug was given every other day. Tumours occur when the building blocks of our body, called cells, lose their ability to control how they grow, divide, and die. Tumours, which have the potential to spread to other parts of the body, are often called cancers. In one recent study, aspirin reduced the risk of bowel, stomach, and esophageal cancer by up to 40%. Overall, studies suggest that aspirin reduces the risk of bowel cancer by just over 20%, and all other non-gastrointestinal tract cancers by 12%. Aspirin also appears to reduce the risk of tumours spreading by the time it is diagnosed, and may also be associated with a lower number of cancer-related deaths in those who take it every day. How aspirin reduces the risk of cancer is not entirely clear, but may be due to helping the immune system to recognise and kill cells that are becoming increasingly abnormal and may develop into tumours. Aspirin does increase the risk of bleeding and ulcers in the stomach and other areas lining the gastrointestinal tract. The risks of taking the drug are likely to outweigh the benefits over the first 2 to 3 years of treatment, and the overall benefit of a reduction in cancer risk starts to become more clearly visible after 5 years of regular treatment. High-dose aspirin taken every day for a minimum of 5 years has been shown to be particularly effective at reducing the risk of tumours and bowel polyps in the inherited condition HNPCC. In a study led by Professor Sir John Byrne, patients given aspirin on the trial developed up to 60% less bowel polyps and tumours. As of yet, there have not been extensive trials to determine the lowest dose of aspirin likely to reduce the risk of HNPCC-related tumours. It is also not clear if aspirin will reduce the risk of cancer for patients who have a family history of cancer, where a change in a gene associated with HNPCC has not been identified. It seems likely that the reduction in bowel cancer rates may be at least similar to those found in the general population. When we talk to patients with a family history of bowel cancer, we stress that a diet high in fresh fruit, vegetables and fibre may reduce the risk of bowel cancer, and there is evidence that smoking, drinking heavily and eating a high amount of processed red meat, such as sausages, bacon and ham products, may be associated with a higher risk. If you have a family history of bowel cancer, particularly if it has affected more than one individual, or was diagnosed under the age of 50 in a close relative, we would recommend that you discuss with your GP if a referral to a family history of cancer clinic may be helpful. Occasionally we recommend patients with a strong family history of bowel and related tumours undergo regular screening to try and find and remove any early suspicious changes before they turn into cancer. Bowel tumours are usually curable if caught at an early stage, and we strongly recommend you discuss with your doctor if you have any change to your bowel habit which lasts for a few weeks, or blood loss from your back passage on more than one occasion. Please find patient and general practitioner leaflets on the pros and cons of taking aspirin as a preventative measure to lower the risk of cancer attached to this podcast. If you are interested in finding out any further information about this and related topics, you may find our other podcasts on diet and cancer, symptoms of cancer, HNPCC and familial polyposis helpful. Thank you for listening.